To a health story beyond the headlines of this COVID crisis. Across the country, women undergoing fertility treatments have been forced to put their dreams on hold as hospitals and physicians scale back on non-emergency procedures. A harsh setback for so many, additional heartache in an already emotional journey. ABC's Erielle Reshef reports.
And I knew going into this appointment that there was a really good chance they were going to cancel it.
The heartbreaking burden of the COVID-19 crisis stretches far beyond fighting the virus itself.
COVID-19 has basically put a halt into everything that we've been striving for over the last 3.5 years.
For Tara Engelberg and her husband Glenn of Colorado, their grueling struggle with infertility has come to a temporary crossroads.
The fertility treatments for us is really possibly the only way we may ever have a child. And we were days away from our treatment when COVID-19 put a stop on our care.
The dangers of the pandemic prompting hundreds of doctors nationwide to scale back fertility treatments out of concern for the safety of their patients and staff.
Since we were in the middle of our treatment, at that time we did have a choice. And it was terrifying to be in that position where you know probably the best outcome for everyone is to stop treatment. But your heart is just so broken because this is what you've been waiting for.
Tara has been candidly documenting her story on Instagram to connect with others, shooting this video just after that visit to the doctor.
And I'm perfectly, okay with it. Because I know it's what's best.
A painful pause to a journey already fraught with anxiety and anguish.
It's just unknown territory and very scary times.
It's a very scary and emotional roller coaster.
Infertility affects more than 10% of Americans between the ages of 18 and 44. Dr. Glenn Chapman of Weill Cornell Medicine in New York is among the fertility specialists who dramatically reduced procedures, a decision not taken lightly.
We actually saw the writing on the wall. We saw the number of cases going up exponentially. We saw that there was no cure for this disease. There was no treatment for this disease. I think there's a trade-off there that being socially responsible and having a pause in treatment for a short period of time was the right thing to do.
For Dr. Chapman's patient, Catherine Menges, it's another challenge as she tries to start a family on her own at the age of 42.
It's like once you make the decision and you start that ball rolling, any additional obstacle that comes, I think it really throws you for a loop.
How difficult is it to have this conversation with patients who are already going through such an emotional journey?
It's very difficult. Everyone is time sensitive, and infertility is a disease. Let's get that out in the open right now. This is a disease that needs to be treated. This is also time sensitive, where months and years make a difference in the chance that a couple or an individual will be able to conceive at all in the future.
Physicians forced to balance that urgency in the midst of so many unknowns. Data is extremely limited on how COVID-19 affects women trying to get pregnant.
If somebody got sick during stimulation and they were hyperstimulated, or they don't know the effects of this virus on early pregnancy, we didn't think it was in the best interest of the patients to continue treatment. Now, that was a hard decision. It's not an easy decision to make.
But despite the unforeseen delay, Catherine is staying upbeat.
I think I'm staying positive, and I'm looking forward to starting back up again.
But are there reasons that you're hopeful?
But hope is what keeps me going.
But I think, we are hopeful that we're in good health. We're still, relatively young, everything considered. And we know that the future is bright, even though it doesn't always seem that way.
Is there anything else you would say to other women going through this right now?
I would say that you're not alone.
Erielle Reshef, ABC News, New York.
And we certainly remain hopeful on their behalf, and our thanks to Erielle.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.